Appendicitis occurs if your appendix becomes inflamed or infected. The appendix is a small tube-shaped organ attached to the large intestine. Nobody knows what the appendix purpose is, but we do know that appendicitis is very, very serious. Hello and welcome to another episode of The Spotlight on Food and Health Communications, your number one go-to media source for credible and timely health information. My name is Victor Marbury. Today on the program, we will be focusing our spotlight on appendicitis. What is appendicitis? What are the signs and symptoms of appendicitis? What's the way forward? How do you prevent yourself from having appendicitis? All this and more I will talk about when I come back from this break. Please do not stray. Welcome back. It's still the program Spotlight on Food and Health Communications, and today we are focusing our lights on appendicitis. Now, I need you to understand that your appendix is a finger-sized tube located where the large and small intestine connects. It has no known function, but if it gets inflamed or infected, you'll need immediate treatment. An inflamed appendix may cause pain off and on, or it may burst open when it gets, rupture, causing sudden, severe pain. A ruptured appendix can spread bacteria through the abdominal cavity. This bacteria triggers a serious and sometimes fatal infection called peritonitis. Now, appendicitis happens when your appendix becomes inflamed, likely due to a blockage. It can be acute or chronic. In the United States, appendicitis is the most cause of abdominal pain, resulting in surgery. Up to 9% of Americans experience it at some point in their lives. The appendix is a small pouch attached to, the intestine, which is located in your lower right abdomen. When your appendix, becomes blocked, bacteria can multiply inside it, and this can lead to the formation of pus and swelling, which can cause painful pressure in your abdomen. Now, appendicitis can also block blood flow, and we understand that this has happened to quite a lot of people, and it has even led to death. If left untreated, if you leave your appendicitis untreated, appendicitis can cause your appendix to burst. Now, I want you to understand that every human has appendix, and that's what I explained to you. It is located at the lower part of your right abdomen. Now, this can cause bacteria to, spill into your abdominal cavity, which can be serious and sometimes fatal. Now, there are two types of appendicitis. We have the acute appendicitis and we have the chronic appendicitis. Let's start off with the first one, the acute appendicitis. Now, acute appendicitis is a severe and sudden case of appendicitis. It's most common in children and young adults between the ages of 10 and 30 years of age, and it occurs more frequently in males than females. Now, pain tends to develop and intensify quickly over the course of 24 hours. It is that fast. It requires immediate medical treatment. If left untreated, it can cause your appendix to rupture. This can be a serious and even fatal complication. Now, acute appendicitis is more common than chronic appendicitis, occurring in about 7 to 9% of all Americans in their lifetime. Learn more about the similarities and differences, which I will tell you about as we unfold proceedings on the program this very beautiful day. Now, moving on to the next one, we're talking about the chronic appendicitis. Chronic appendicitis is less common than acute appendicitis. We understand that it occurs in only about 1.5% of all people who have already had a case of chronic appendicitis. Now, in chronic cases of appendicitis, the symptoms may be relatively mild, and they are thought to usually occur following a case of acute appendicitis. So it is understood that quite a lot of people who experience chronic appendicitis must have first experienced the acute appendicitis. And we understand that the symptoms may disappear before reappearing again over a period of weeks, months, or you can even take a year. Now, this type of appendicitis, just like you can see on the screen, can be challenging to diagnose. Sometimes it's not, diagnosed until it develops into acute appendicitis. Now, chronic appendicitis can be very, very, very dangerous. Get the information you need to know, recognize it in time, get to know the symptoms, which I'm going to tell you about very, very shortly so you can get aware. And if you have it already, go see your doctor as fast as possible. Now, I know you've been waiting for this. What are the signs? What are the symptoms of appendicitis? Now, appendicitis pain often starts off as a mild cramping in your upper abdomen or belly button area, and then, it then moves to the lower right quadrant of your abdomen. And this pain often, begins suddenly and then gets worse when you move a cough, and then it's intensified to the point that it can even wake you up from your sleep. It goes further, to get into severe and different from the abdominal pain. So when you begin to, you begin to experience that the kind of pain you're having within your abdominal region is quite different from the normal one. It might just be that appendicitis is by the corner, and it keeps on getting worse by the hours. That's how you know it. The pain starts mild, it gets to worse and keeps growing, and within few hours it's so severe that you cannot handle it any longer. If you experience this, it's a sign, it's telling you that appendicitis is actually knocking on your door. Now, what are all the symptoms of appendicitis that you may also experience? Number one, loss of appetite. You do not just want to eat anything. Number two, indigestion. Just like you can see on the screen, there's that lady who's lying on the bed. It could just be that she's having indigestion problems. She's holding, cramp in her belly and, growing her bowels and all of that. That is actually a sign as well. Number three, you could also experience nausea. You could also experience vomiting as well. Just like you can see on the screen, the lady who's vomiting, it is also a symptom. You could also experience abdominal swelling. You could also experience low-grade fever. Yeah, there are quite a lot of persons who will go ahead to experience fever as a symptom, but not fever which is very, very intense. It could just be a low-grade fever. Now, less commonly, you may experience bowel problems, which include diarrhea, constipation, the desire to make bowel movements, inability to pass gas, and that's a very, very serious issue. So when you begin to discover that you're having constipation issues, you're making bowels movements, and most importantly, you're not able to pass out gas, come on, man. He tells that you should go see your doctor as fast as possible. Now, if you're constipated and you suspect that you may have, appendicitis, avoid taking laxative or using an enema. So once you discover that you're beginning to have all of those signs and symptoms, please stay away from laxatives and avoid using enema. Now, this treatment, if you use them, they can cause your appendix to burst. So contact your doctor if you have, tenderness in the right side of your abdomen, along with any of the other symptoms I've told you about appendicitis. I will talk about this one. When you get to discover tenderness at the right side of your abdomen, when you begin to realize that it might just seem that the right part of my abdomen is getting softer, it's getting more tender than the left part of my abdomen, it might just be a sign, and please go see your doctor as fast as possible. Appendicitis can quickly become a medical emergency. We've seen cases of where people just get to experience it, boom, and the next thing, it's already a medical emergency. So please do not wait, do not hesitate. If you feel the signs, if you feel the symptoms, go see your doctor immediately. Now let's talk about children a bit. If your child develops symptoms of appendicitis, please contact your doctor immediately. Do not try to do anything of your own. We've said it here over and over and over here that self-medication is never the best option. And when it comes to, dealing with children, come on, that's way off it. They are very, very susceptible. One wrong move and the life of your child is claimed already. So please, if you have your child having the symptoms, go see your doctor as fast as possible. Now, what are the causes and what are the risk factors involved in these? You should know the causes and you should know the risk factors so you could be aware, you could be informed, and you could be more enlightened so as to steer away from this dilapidating and very extraneous disease. In many cases, the exact cause of, appendicitis is not really known. So really now, I really want to debunk, the things that we've heard over and over growing up as little children, and as long as it has been out there that appendicitis is caused by stones, caused by rebels, caused by, pebbles and the likes. It's not true. There is actually no known exact cause of appendicitis, but we understand that experts believe it, develops when part of your appendix becomes obstructed or blocked. That is what the experts believe causes it. That when your appendix becomes obstructed or becomes blocked, appendicitis gets to develop. So it's not really true that it's caused by stones, caused by pebbles, caused by little rocks and the likes. Those are just, fallacies. Now, many things can also potentially block your appendix, and you should know them. Number one, a buildup of hardened stool. For those of you who like to take, meals without water, especially the bread folks, you like to take bread, please, if you're the bread kind of person, always ensure that you're taking bread with something liquid. Do not just take things that will get to harden your stool, because it could be a potential build-up to the blockage of your appendix, which could lead to appendicitis. So please be aware. Number two, enlarged lifoid fallacies. If you have enlarged lifoid fallacies, it could also be a factor. Number three, intestinal worms. We've always said it. Please know when to deworm. I mean, of course, you do not deworm every now and then. You deworm periodically, but please make sure it's consistent. Know when to deworm yourself so those worms do not get to grow up in your stomach and then begin to affect your intestines and get to lead to intestinal, damage and the likes. Number four, traumatic injury. Some persons who go ahead to have traumatic injury, it could also lead to appendicitis. And number five, tumors. If you have tumors, please get it treated so it doesn't stay too long and then begin to affect your appendix, thereby leading to appendectomy. Many other conditions can also cause abdominal pain, and that is why we're here telling you all those things so you could be aware, you could be informed. I'm going to go for a very quick break right now. When I come back, I will be wrapping up proceedings, telling you the rest of the things you need to know as regards appendicitis. Please stay with me. Welcome back. It's still the program, The Spotlight in Food and Health Communications. My name is Victor Waberi, and we've been talking appendicitis. Now, I need you to understand that appendicitis can affect just anyone. But, there are some people who are more likely to develop this condition than others. And when I say that, I'm talking about those who have, high risk factors of the appendicitis disease. Now, what are the factors involved that could increase your chances or lower your chances? Number one, age. Appendicitis most often affects teenagers and people in their 20s. So if you're within your teenage age and the age of your 20s, you need to be very, very careful and take to all the preventive measures to stay away and ensuring that you do not develop the appendicitis disease, because it's very, very high that you'll have it between your teenage age and your 20s. But and another factor we understand is the factor of sex. Appendicitis is more common in males than females, and that's very, very true. We've got quite a lot of men who actually get to have appendicitis than the number is to the women gender. And number three, we have family history as a factor. People who have family history of appendicitis are at a heightened risk of developing the appendicitis disease. And number four, complications. Appendicitis can cause serious complications if your appendix ruptures, which can cause, fecal matters and bacteria to spill into your abdominal cavity. And you should know that a ruptured appendix can lead to, painful and potential life-threatening infections, which includes, just like I said earlier, peritonitis, number 2, abscesses, and number 3, sepsis. So please do all it takes to ensure you're staying at the preventive side of having, the disease. Now, to prevent or manage complications, I need you to know that your doctor may prescribe antibiotics. They might want you to go in for a surgery or, go in for some form of treatment. But in some cases, you might develop side effects or complication from the treatment, which is true. And because of this, there are quite a lot of people who, have the disease and do not really want to go for surgery because they're scared of side effects. They do not want to take the antibiotics. They do not really want to go in for some treatment because of the side effects they've heard from family members, from friends, from folks. But can I tell you something? The side effects you're going to feel is less hazardous than to keeping that disease on the inside of you, than to keeping that appendicitis and going through what's going to be more and more horrible in the end. So please, if you've been diagnosed with appendicitis, go in for a surgery. If your doctor says go in, take your antibiotics if that's what's prescribed to you. Please, not for the fear of the side effects, neglect to go in and get that thing removed from your body. Please do that. I know you're going to do that. Moving on, talking about the prevention. We've always said it here that prevention is better than cure. And that's what we do here. When we've told you about what the disease is, when we've told you the signs and symptoms to look out for, we tell you how, which is more importantly, to prevent yourself from having the disease. Now, I need you to understand that there is no sure way to prevent appendicitis. There is actually no sure way. It's never been proven, but you might, be able to lower your risk of developing it by the couple of things I'm going to tell you. Number 1, by eating a fiber-rich diet. Now, although more research is needed on, the potential role of diets, appendicitis has been found to be less in countries where people eat high fiber diets. So I'm encouraging you, if you want to be on the preventive side, ensure you're having fibers as part of your meal. Now, foods that are high in fiber, I'll just go ahead and give you some of them so you could get them incorporated to your meals. Number 1, fruits. Number 2, vegetables. Number 3, lentils. Number 4, split peas, beans, and other legumes. Talking about oatmeals, talking about brown rice, talking about whole wheat and other whole grains. These are meals you could get incorporated to your daily meals to ensure that you're actually on that, preventive side. Now, your doctor may also encourage you to take a fiber supplement. And so if you're looking at a fiber supplement combo and you do not know one, I'll just go ahead and give you a very simple, supplements that you could avail for yourself, and it could just help you be on the preventive side. Number 1, add fiber by sprinkling oats bran, or wheat germ over your breakfast cereals, your breakfast yogurts, and your breakfast salads. You could just, go ahead to sprinkle some oat browns or oats wheat germs on your breakfast, regardless of whatever it is. Number 2, cooking or baking with whole wheat flour whenever possible. So whenever you get a chance to cook or bake, please do it with whole wheat flour. Yeah, it could just go ahead to putting you on the preventive side. And talking about swapping your rice with brown rice, your white rice with brown rice. Yeah, if you're used to white rice, you could just go ahead and swap that your white rice with a brown rice, and it could just help you. Number 4, adding kidney beans or other legumes to salads. Eating fresh fruits for dessert. So when you've eaten and you just want to have some desserts, just have it at the back of your mind that, come on, instead of having desserts, you could replace it with some fresh fruit. And this is where we let down the anchors on the program today. I believe you've learned a thing or two, and please do well to subscribe to our YouTube channel. If you got content, if you got value from this very content, go ahead and like our videos. And if you have any thoughts, comments, contribution, whatever it is, the comment section is all yours. Do well to leave your thoughts, your questions, your comments, whatever it is, in the comment section, and we will do well to reach out to you. Till I come your way next time, I'm saying to you, keep staying healthy, because a healthy man is a happy man. If you want to be happy, stay healthy. Till I come your way next time, my name is Victor Waberry. I'm out.